Here, this is how we basically name the different mesenchymal tumor that is actually coming from the benign tumors, all right? Now let's talk about how do we name the benign tumor, but they're epithelial cells. Okay, they originate from the epithelial cells. Now, for this one, let's go here. Now, let's talk about this. Let's talk about here, right here. If you look at this one, these are epithelial cells, right? But every epithelial cells that is originated from the mesenchymal. But if they're benign tumor, then how do we name it, right? Remember, benign tumor, these are epithelial cells, but let's just say, these epithelial cells right here, right? They like to hold each other, stick with one another, right? Like this. But let's just say, if these epithelial cells, they're arising or they're coming from, let's just say, glandular epithelium. Like, for example, what is glandular epithelium? Glandular epithelium basically means that, look, if this is an epithelium right here, right? And if they basically make or arrange themselves in a circular pattern, let's just say there is this and there is this epithelial cells right here, and they arrange themselves in, let's just say, in a circular pattern, right? Circular pattern like this, right? Then we call them our glandular pattern, right? This is very, very important, right? Glandular pattern. So whenever the neoplastic transform cells, they arrange themselves or arrange in a glandular pattern, then we call them an adenoma. Okay, this is the name. This is something you have to remember. Adenoma. All right, adenoma. Or sometimes, these cells, they arise from glandular epithelium, but they do not make glandular pattern or circular pattern. We still call them an adenoma, okay? And this gland, the word the gland basically referring as any cells that is secretory in nature, right? That's why we call them a gland, all right? So whenever you hear term glandular pattern, they're basically arranging themselves in an acinar or circular pattern, right? Then we call them an adenoma. But not only this, you have to remember there's a word oma is there, right? But remember, these are epithelial derivatives, right? Mesenchymals, these are the names, right? This is how we name. Okay, chondroma, lipoma, rhabdomyoma, fibroma. But epithelioma, if the cells are coming from epithelial cells, we call them adenoma. That's one, right? Which makes a glandular pattern. Now, not only you have to know adenoma, this is one. Second thing you have to remember here is that you have to remember concept of papilloma too. What is papilloma? Remember, papilloma basically means papilla, like a finger-like projections, like a warty, or let's just say finger-like protrusions that are actually comes from the surface epithelium, right? So if I look at this epithelium right here, right, and then there's this, right? And basically, look, you have this all. But here, you have all this, like, look at this, the finger-like projections, and they're also supported by maybe like some, let's just say, connective tissue down here, right? They're basic protrusions, right? Warty-like projections that are coming out, right? Then we call them a papilloma, okay? Now remember, these are epithelial derivatives. Now, you have to know adenoma, you have to know papilloma. On top of that, you also have to remember some of the concepts. Like, for example, remember this third one, which is polyp. What is polyp? Remember, polyp can be benign, polyp can be, let's just say, malignant, or polyp can be neither of those. What does that mean? Sometimes, if you have heard, there is a inflammatory polyps that happens from the your nasal mucosa, right? You can have inflammatory polyp, or you can have, let's just say, colonic polyp. Usually, here, like for example, this is a colon, right? There is basically from the mucosa of the colon right here, there is the mass or pedunculated mass. Let's just say you have a pedunculated or sessile mass, or just like hanging on this, like this, right? The protrusions are hanging on the lumen, then we call them a polyp. Polyp is any like collections of mass or tissues that are basically hanging around in the lumen, right? Those are called polyp. Polyp can be benign, can be malignant, can be basically inflammatory, all right? So any of that, right? Basically, those polyps are usually pedunculated and sessile. So you have to remember, you have to be very, very clear concept what is adenoma, okay? What is papilloma? What are polyps? And now let me tell you, sometimes, you probably have heard something called like a cyst. What are a cyst? Look, you can have a cyst adenoma, you can have this concept of, look, if this is, this is lumen, right? And this is sort of like epithelial cells, which are arranging in a glandular pattern, right? Look, right? And as they're appearing in glandular pattern, and this gland, remember they secrete, what are they secreting? A lot of this fluid, right? When they secrete, and there's collections of fluid that you see in here, on a cyst, it forms a cyst, like cyst cavity, right? And you find like serum-like fluid, right? Or cyst, or clear water fluid, right? Then we call them what? Cyst. Okay, there's a cyst which is filled up with clear fluid. On top of that, there is also the cells are arranged themselves in a circular pattern. Then we call them an adenoma. So you can have this is, if it's a benign, then we call them obviously we add oma. Then if it's then we call them a cyst adenoma, right? Cyst, collection of fluid, right? Which arrange this cell, these epithelial cells arranged in a circular patterns, and they started secreting like clear fluid, let's say, and basically that clear fluid is up a cyst with fluid. Cyst is filled with fluid, right? And obviously, and those cells around them are arranged in a circular pattern. Then we will call them a cyst adenoma, right? Now, sometimes these glandular cells can actually, instead of producing like, let's say, serous or like clear fluid, they can also produce mucin. Right? So then, in that case, we call them mucinous adenomas, right? Mucinous cyst adenomas. That's what we can call, right? So you can have mucinous adenoma. You can have like a cyst, like serous fluid, a cyst adenomas, right? It depends on the types of fluid is in the cavity, all right? Sometimes you can also have, inside this one, let's just say inside this cyst, let's just say if this is a cavity, right? And sometimes you have these epithelial cells are lining here, and not only this is there, but sometimes inside here, there is also like a finger-like projections are coming out here. Look like this, right? If there's a finger-like projection, also you get to see, then we call them a papillary cyst adenoma. All right, guys, if you look at it here, I'm actually showing you the image of the adenomas. And if you look at this cells right here, they're arranged in more in a circular pattern, right? So when you look at microscopically, this is what adenomas looks like, okay? Which has a glandular circular patterns, right? Now, if I look at here, now this is how its papillomas it looks like. And I obviously got this image from this site right here. If you want to go and read more about this, you can use this site. And if you look at it right here, it has this papilla, like finger-like or warty-like projections that are coming out. And histologically, you have to look at this sort of finger-like projections from the surface epithelium. And we basically describe this as papilloma. And then if you look at this one, this is basically a big cyst cavity. All right. Now this is an image of a cyst adenoma. All right. Look, whenever there's word oma is there, right? Generally they are benign. Obviously with exceptions, right? Like some of the exceptions would be, as I discussed about it, melanoma or invasive meningioma, right? These are basically malignant tumors. So you have to remember the exceptions. Or there are also some conditions where there's the suffix oma is added, but they are neither benign or they are malignant tumors, all right? These are non-neoplastic, like for example, choristoma or hemaratoma, all right? So you have to remember this again, whenever we discuss about this, the benign tumors, you have to divide into either mesenchymal or epithelial, right? And mesenchymal, so this is how we name it, with the oma added, right? Now, after this, let's go and talk about how do we name the malignant tumors? Let's talk about this. Now again here, we come to malignant tumors right here. And again, the malignant tumors, these malignant tumors, or these are cancerous tumor, right? You can again derive into, let's just say, mesenchymal, right? Or you can have a epithelial, right? In origin. Whenever there's a mesenchymal, remember these malignant tumors are named a little bit different than how we name the benign. Usually if they're coming from the mesenchymal, like for example, you're talking about the blood or you're talking about the, connective tissues, right? Then usually with the mesenchymal, we add sarcoma there, sarcomas. And sarcomas are usually named for the solid tumors, all right? Sarcomas are for solid tumor. And for epithelial tumors, it's coming from epithelial malignant tumor, we call them carcinomas. All right, this is something that you have to remember, all right? You can either say, so every time when you see sarcomas added, then you have to think about these are what? Mesenchymal tissues, all right, in origin. And if you saw carcinomas, then you're basically thinking about these are epithelial, all right? Epithelial origins. So if you look at this chondrocytes, like right here, right? We call them, if it's a benign, we call them a chondroma. But if it's, let's say, malignant, we call them a chondrosarcoma. So let's write down here. So this is called, let's just say chondro, right? But there's a word, sarcoma into it. So we basically write chondrosarcoma, all right? Now, if it's, let's just say adipocytes, right? We call them obviously there's a lipo, right? So you can simply say there is a lipo, but it's a liposarcoma, right? So let's just write down here. It's a lipo, right? But this is a sarcoma, right? Now, what about the striated muscle? We simply say it's a rhabdo, right? We're just naming it. It's a rhabdomyosarcoma, right? Sarcoma. What about this fibrocytes? Again, it's a fibro, right? But it's a fibrosarcoma. We're just naming it, all right? What about this smooth muscle cells? There's a leiomyoma for the benign, but for the malignant, it is a leiomyosarcoma, right? There's a word sarcomas are there. Now, but these are for connective tissue. But if you name, let's say, blood, like white blood cells, you know, you name it differently, right? If there's a tumor that is coming from, let's say, lymphoid lineage, right? Then usually, these are two lymphocytes, all right? And we usually call them lymphoma. Remember, there's oma is there, but this is not benign, okay? This is malignant, all right? So this is also one of the exceptions, right? So this is one of the exceptions. And look at, what about this? This is neutrophils right here, right? But remember, I'm just giving you one, you know, for example of this, right? How we name it. So if it's coming from, let's just say, the myeloid lineage, right? The white blood cells tumor, then you can call them it can be a leukemia. All right? Leukemia. And this can be a leukemia too. All right? So usually we name leukemias or lymphomas. All right? So usually we name these white blood cells, blood cells, the formed elements, either we say leukemia or lymphomas, all right? This is an exception, even though there is oma is there. And especially the leukemia is one of the exceptions. This is a little differently to how we name the malignant tumor that is actually coming from the mesenchymal cells, all right? Now let's talk about how we name the carcinomas, all right? Remember, these are epithelial cells. This is apparent glandular pattern, right? If it's coming from, let's just say, epithelial cells. Let's say, for example, it's coming from skin, right? If it's coming from skin epithelial cells right here, right? Let's just say this skin epithelial cell, then we call them what? Squamous. Remember, the cells in the skins are called. It's a keratinized squamous epithelium, right? So we call them a squamous what? Carcinoma. Squamous cell carcinoma. So it's a squamous cell carcinomas, right? Remember this, if there's a word carcinomas that's here, they're basically saying that there is you can simply say, but if I said it to be very, very specific, if I'm talking about skin, then you can say cutaneous squamous cell carcinoma, okay? If you're talking about, let's just say that, you can have what is this? In lungs, right? In lungs, you can have tumors of the lungs, right? And if they're coming from lungs right here, right? And if there's tumor that happen that basically, usually in the smokers, smokers, the type of the cancers that you can get is a squamous cell carcinoma of the lungs, all right? Sometimes with the non-smoker people, sometimes if you look at the histological, and if you look at it, and if you see it microscopically, if you see it, and then the cells are arranged in a more glandular pattern, then we call them adenocarcinoma, right? So this is how you can name it. Like, for example, like look here, adenocarcinoma, right? Adenocarcinomas of the lungs. Or let's say adenocarcinoma of the GI tract right here, all right? Which is very, very malignant, right? Because adenoma is basically saying that this epithelial cells are arranged in a circular pattern, right? I'm repeating this so many times. So, based on the microscopically, okay, what do you see histologically? You can see whether they're in circular pattern, whether in glandular pattern. Then, if you see glandular pattern, as we said, as we've been talking about, we say adenocarcinoma, right? Now, if you're talking about, there also, let's just say, you can have papillomas, right? But papillomas are benign, but you can also have what? The cells that can actually arrange themselves in a papillary way, right? Then you can call, what do you call them? Then you can call papillary carcinomas, right? You can call papillary carcinomas. If cells are basically arranged in a papillary and they are malignant, then you call them a papillary carcinomas, all right? And also you can have a polyp, which you discussed about it. It can also be malignant as well, all right? And I'll show you the different histological pictures of them. Here I'm actually showing you the image of the adenocarcinoma. Remember, this is a malignant tumor, right? So if you look at all these structures of this, right? They appear in more in a circular pattern like carcinoma, but they also have a different. They're hyperchromatic, right? The nucleus appear much more darker. So these are some of the changes that you see that in when you talk about the adenocarcinoma, right? And now, if you look at this one right here, look at, if you look history, you see this right down here. There's a finger-like or roti-like projection coming out here, and this is a classical for the papillary. But this image is actually coming from the papillary renal carcinoma, and I've cited here. This is where I got this image from. The previously, I've also cited if you want to go and read more about it. And then after this, let me quickly discuss about how actually this malignant tumors, they spread. This is something that you have to remember. Usually, like when you talk about sarcomas, right, the mesenchymal tumors, they usually all the time they spread through hematogenous route, meaning that they actually spread through blood vessels. And how do they do it is that, if you look at the blood vessels like arteries have like very difficult to penetrate. And so because of that, most of the times they actually penetrate through the veins when it comes to sarcomas, easily penetrated. And because of that, lungs is one of the most common site of where the hematogenous spread for sarcomas. And if I talk about the other one, which is the carcinomas, carcinomas usually spread through the lymph vessel, like lymphatic vessel, like here, this lymph vessels, right? So, but there are obviously some exceptions, and you should remember there are 4 classical exceptions where there is the carcinomas spread not through the lymph vessels, but they actually do with the other path, okay? And one of the classical is, let's just say, hepatocellular carcinomas. Those usually spread through the portal veins. And other one is renal cell carcinoma that also spread through renal veins. And you have a choriocarcinomas, and that is usually through the early hematogenous spread that happens in early beginning of the life. And also there's a follicular thyroid carcinomas. But now after this difference between like your malignant tumors and how we name it, I have to talk about 2 conditions. And that 2 conditions this is how we're gonna, you have to remember there are 2 conditions. Let me erase this and I'll write it down here. All right, these 2 conditions is basically mixed tumor. All right, let's just say this is mixed tumor. All right, and also I have to talk about the teratomas. Okay, what are this? These 2 things I have to talk about. What is the concept of the mixed tumors? All right, usually mixed tumors are this. Let's just say this is one cell right here, right? Right? And what happens is that there is a neoplastic transformation happens to these cells, to this germ layer. This is a single, let's just say, this is a single germ layer, right? And this single germ layer, what happens? When it goes into neoplastic transformations, all right, it goes to the series of mutations, and they started giving the progeny cells, or they start making the clone of these cells. But these cells, some of them appear like this, some of them appear, let's just say, maybe this, like this. There's a different types of shape and size you see, right? And whenever this happens, right, it is originating from a single cell, though, right? But it is giving rise to different size, a different shape of the cell. It is giving the pleomorphisms of the cells, right? Then we call them a mixed tumor, right? What is mixed tumor again? It is originating from single cell, but giving rise to different morphological changes of the cells, right? And that is what is called mixed tumor. One of the classical examples of the benign mixed tumor is what? Pleomorphic adenoma of the salivary gland. So one of the classical example is pleomorphic, let's just write down here. The pleomorphic adenoma of the salivary gland. That's a classic example. If you're talking about, but this is again, it's adenoma, right? It's pleo referring as different size and shape of the cells. Adenoma is basically referred as how the cells appears in microscopically. And on second of all, it can also be malignant, right? If it's a malignant, then we simply call them a malignant. We call them a mixed tumor of the salivary gland, right? So this is how we name it, right? So, and then after that, we have to talk about, after the mixed tumor, let's talk about what teratomas means. Remember, tera, this tera, what teras? It's a Greek word for monster, all right? It's Greek word for monster. And what is teratomas? Usually teratomas are basically, what is it? These are originating from totipotential cells. And what are totipotential cells? If I have to make toti, let's just say, we'll erase the first part and we'll say, the totipotential basically means that, let's just say this is a germ cells, right? This germ cell is a totipotent, meaning that, it can give rise to, it has a potential to give rise to any different types of cells. Okay, it can give rise to ectoderm, it can give rise to endoderm, it can give rise to mesoderms, okay? So that is what totipotent means. It has certain potential to give any rise to the cell. If there is a, let's just say, if there is some sort of neoplastic transformations happens, or this cells go through, let's just say, neoplastic transformations, then what happens is that, it can give a condition called teratomas. And these teratomas, usually, arises from the more than 2 germ layers. It can have, it can come from, because it has a potential to give any rise, right? So it can give rise to ectoderm, it can give rise to endoderm, it can give rise to mesoderms, right? So basically, whenever there is a teratomas out there, you can see collections of the tumors that can have derivatives of ectoderms or endoderms or mesoderms, or sometimes maybe 2 of these ectoderm endoderms can be there, sometimes, or maybe combinations of all 3s are there, right? So sometimes in the teratomas, you can see what are the derivatives of ectoderms, right? You can see skin like hairs and hair follicles, you can see endoderms, like for example, the GI mucosa cells, or let's just say lung mucosa cells, and mesoderms like blood vessels or other connective tissue layers, you get to see there, right? So there's a mix of this tumor, you get to see. So whenever there's a neoplastic transformations happens, and if it's a totipotential, if it's coming from let's say ovaries or testes, right? Usually it's coming from ovaries, let's say ovaries or testes, right? Because these are total potential to give rise to what? Any of these germ layers, ectoderm, endoderm, and mesoderms, right? So usually teratoma consists of all these 3 different layers, like germ layers, ectoderm, endoderm, mesoderms, all right? And I will show you the image of how it's going to appear. But you have to remember this. Whenever we talk about the teratomas, teratomas are basically a neoplastic transformation that is actually arises from the totipotentials, okay? And it has a tendency, or it has a potential to actually give, and it actually has a tendency to have or arise from the different germ layers, all right? Different germ layer, that's different than mixed tumor, because mixed tumor, it only originated from single germ layer, and if a different morphological changes appeared, all right? This is the difference. So guys, I'm here showing you an examples of the mixed tumor, and this is an examples of the pleomorphic adenoma, and I got this from this site right here. And if you look at it right here, basically, as we discussed, mixed tumor is what? It is actually coming from what? Originating from the same germ cell, and it is giving a different morphological pattern. That is mixed tumor, and one of the classical examples is pleomorphic adenoma. This is what you see right here, all right? And second one is this one. Let's talk about this one. What is this? This is a teratoma. And remember, teratoma, as we discussed, it is coming from what? It originates from totipotent germ cells that are normally found in where? In testes and ovaries, right? Remember, they contain derivatives of all 3 germ layers, like ectoderm, endoderm, mesoderms. That is why you basically see different, look at that, there's hairs out there, like a teeth, you can see all different types of derivatives of all those structures, right? That's what you're seeing on this. And again, this is teratomas. Now today here, we talked about how the benign and malignant tumors, how they're different, all right? And benign also means non-cancerous, right? And then malignant also means cancerous. So we talked about the different between this too. On top of that, we also talked about the nomenclatures of how the tumors are named. Based, if the benign tumors are there, then how do we name it? And if there is, let's just say, malignant tumors are there, how do we name it? Remember, it's the derivatives. You have to remember them, how their names are based on their cells of origin, whether they're mesenchymal or they're epithelial cells, all right? Now, And we also talk about some of the exceptions, like, for example, non-neoplastic tumor, like choriostomas and hematomas. We talked about this. These are very, very important concepts, guys. You guys have to remember this, that, the cancers is second leading cause of the death in the United States of America, right? So you have to remember, if you want to remember a little bit of epidemiology, you should remember that, remember this, let's just say if you're a female, right? Remember BLC. What does it mean? The most common, okay, if it's female, most common cancer that happens in female is breast cancer. The B is referring to breast, right? And what is this? L referring to lung cancers, okay? And C is colon cancers, all right? B. If you're talking about this female, male, it's PLC. That's the mnemonics I'm giving it to you. What is PLC? Okay, lungs is there, colon is there, but the P is referring as a prostate, all right? Prostate. So if you're talking about, so these are the most common cancers that happens is in the United States, right? In female is number one is breast, lung, second colon, and then if you're talking about the male, it's prostate, lung, and colon. And what about the pediatrics? If you want to remember pediatrics, look, usually pediatrics are, most common is leukemias, okay? Second, you have central nervous system lymphomas. Like central nervous system tumors are also very common in pediatrics, all right? So anyway, after this little bit of epidemiology, I hope that I was able to make it very clear to how we name these tumors. All right, guys? Thank you.